The purpose of this video is to demonstrate how the Multicare bed by Lynette can be used as a treatment table in the early mobilization of your patients. These are treatment ideas. It is always up to the treating clinician to determine if they are appropriate to use with their patient. The unique frame allows you to perform early mobility exercises with gravity assist, lower and upper extremity exercises against gravity, and core exercises with or against gravity. The unique frame-based turn allows for earlier bed mobility training for those patients that are too weak or have too much pain to work from a full supine position. When the frame is turned, it allows a patient's core and lower extremities to be worked either with or against gravity. When the frame turns, the patient's weight is shifted to one side, which can allow for increased input to the affected side of a CVA patient. This can assist with neglect of the affected side, as the patient's head will be encouraged to turn toward the affected side. When the patient's weight is shifted to one side, the shoulder joint and hip joint on the opposite side will have less weight. These joints are opened up and allowed to have an increased range of motion and stabilization for performing PNF patterns or active assisted range of motion. The Multicare bed allows you to place the patient in the vascular position. In this position, you can practice modified bridging, lower extremity exercises, and heel cord stretching. The vascular position allows the patient to begin early weight-bearing exercises. With the patient in the bridge position, they can push into the bed performing a modified leg press. The patient can begin to work on bridging and core strengthening. Total knee replacement patients can perform active assistive heel slides with a friction reducer under the heel. This position allows for gravity to assist with bending the knee, which can be less painful. This is also a nice position to assist with swelling of the lower extremities. The therapist can use this position when performing stretching or an active assisted range of motions to allow them to be in a better position ergonomically. The reverse Trendelenburg position is optimal for performing core exercises, squats, and lower and upper extremity exercises. The Lynette Multicare footboard will hold 150 kilos, allowing the patient to be weight-bearing when in the reverse Trendelenburg position. This allows the patient to begin pre-ambulation exercises by isometric work to their quads and gastrocnemius muscles, as well as getting dorsiflexion in the feet. A foam balance pad can also be placed between the footboard and the patient's feet to allow the intrinsic muscles to be activated. When the patient is in a more upright position, it is easier for them to use their core muscles, thus making this position good to start early core exercises. Lower extremity exercises include hip abduction and adduction, heel raises, toe raises, marching, and squats. Putting a CVA patient in this position allows the patient to weight bear on the affected side, thus increasing symmetry, proprioception, and improving body alignment. The orthopneic chair, also known as the cardiac chair position, is perfect for core strengthening, lower and upper extremity exercises, and sit-to-stand exercises. The cardiac chair position can be used to assess the patient's trunk control in a safe environment prior to getting the patient sitting on the edge of the bed. Core strengthening exercises can be performed as well as upper and lower extremity exercises. Weight bearing into the footboard can be used for pre-stance and pre-ambulation exercises. Try early mobilization with Lynette. Discover how the Multicare bed by Lynette can be used as a treatment table for you and your patients during early mobilization.